So like the word says, it involves anxiety or discomfort that a patient feels when they undergo medical imaging. And there's actually been research on this that shows about half or 50% of patients that undergo medical imaging, they experience this raised anxiety. And this is especially true for oncology patients, for example, who are going to undergo imaging like PET-CT. So there's actually been research on this topic also for medical imaging. The number one cause is they may ask themselves, and they may be afraid of what the results may be, and they may ask themselves, will they find something wrong with me? Or if they've already had imaging before, is it going to be worse this time? And the number two reason is, this may surprise some people, will the doctor actually care about me and listen to what I have to say, my side of the story? And outside of the research, we all know there are other issues, like some people are very afraid of needles and afraid of the injections. And then also maybe they're afraid of actually going with inside the camera and have claustrophobia. So there could be a wide range from a patient totally wanting to withdraw or isolate themselves to the other extreme where they're fidgety, restless, can't stay still. They may have rapid breathing, may feel like their heart is racing, their heart rate increases. They may be sweating, they may be fidgety and not able to be still, or they may have a clenched jaw or a clenched fist, for examples. And there's a whole bunch of them that besides this, but those are the main ones. Oh, there is a wide range of things that patients can do to decrease their anxiety and increase their comfort. And that can begin at home and all the way to the waiting room. So you can listen to relaxing music before and within in the waiting room, probably with your earplugs. There's actually been studies showing there's mood lifting properties of music, and it helps reduce anxiety, and it can also reduce heart rate and high blood pressure also. Now, there are a variety of breathing exercises that can be performed. I'm not going to demonstrate that here, but you can look online, or they can ask their doctor to give them some examples. And then several people may want to pray, meditate, sing, or play an instrument. So try to do that at least the day before and up until you go to the appointment. It's important not to be in an overstimulated environment. And by that, I mean, don't sit all day in a bright, direct lights, flashing lights. Don't be in a room with loud, irritating, or background noise the day before and the morning, or up until your scan time. And also that includes what you're watching on TV or on your computer. You should try to concentrate on shows or whatever you're watching that have positive outcome, movies or TV shows. And that might include, examples would be like nature. Look at a show that talks about a hero, or maybe a cooking class, things like that. If the patient likes to read, start reading a book the day before, and you can bring that also to the waiting room with you. This is something a lot of people don't think about, the color of your environment that you're in at your home. There have been studies on this. The color blue is the greatest one that reduces the anxiety and produces calmness. So if you have a room that's blue, even purple hues, try to stay in those rooms before your imaging study. A natural environment can also reduce anxiety and increase your comfort. And that maybe you may look at magazines or books or shows that show nature. If you like to garden, you could garden some, or sit in a room where you have a lot of plants. Interestingly, there have been some studies also about aromatherapy. And for medical imaging, it has been shown that it really does not have any great effect. So hopefully that's a list of items that can help the patient reduce their anxiety. Yes, so as I mentioned before, if you have your music on your phone or a small recording device, you could take that with you into the waiting room and listen to music that way to help relax. You can also listen to audiobooks also. If you're very anxious you can actually ask the imaging center if they have another quiet room that you could sit in while you're waiting. And then another item that was dear to my heart because I'm a musician and I thought about going into this area is called music therapy. That's becoming more and more popular. Some institutions may not have it at this point, but you can always ask. And what that involves is they can have a professional musician play or sing an instrument while you're in the waiting room or in their separate private room. And even in some of the rooms, like for a PET scanner, they inject the radiopharmaceutical and you have to sit and wait in a room. They can play the music in that room. I do have a colleague as an example. Her name is Sarah Fry in St. Louis, who started a study which is ongoing where they had a live musician play an instrument or sing for 30 minutes while they were waiting for that uptake period of their PET radiopharmaceutical. And they had experimental and control groups. And they showed that there was a statistically significant difference between the two groups. The experimental group with the music did have a higher percent decrease in anxiety. So those are some things you can ask for at the institution. If they have another room, bring your music or book with you. And then you can ask if they have music therapy.